Hello, my name is Ash, a counselor in training. This is my Relatable study podcast for individuals who need help studying for their NCE, CPCE, and other related counseling exams. I'm going to go through many questions from multiple resources and make the answers relatable to both you and me. So get your listening ears on and let's get studying. In a research study, every element of the population has an equal chance of being sampled. What type of sampling is this? A. Random sampling. B. Systematic sampling. C. Stratified sampling. D. Equivalent sampling. The answer is A. Random sampling, because every element of the population has the equal chance of being sampled, so everybody has an opportunity to be chosen, and it is done randomly. It is like having a big bag of M&Ms, putting your hand in and grabbing a handful of M&Ms. That would be random sampling because you are choosing random colors, random sizes, so on and so forth. A preschool child's concept of causality is said to be animistic. This means the child attributes human characteristics to inanimate objects. Thus, the child may fantasize that an automobile or a rock is talking to him. This concept is best related to A. Carl Jung's concepts of anima, animus. B. Freud's wish fulfillment. D. Piaget's preoperational period, ages 2 to 7 years old. D. Ego identity. The answer is C. Piaget's preoperational period, ages 2 to 7 years old. This is when the preschool child believes that inanimate objects are able to talk to them. I remember knowing an individual who used to talk to rocks and have pet rocks. In addition, I did know another individual who talked to their stuffed animals and believed that they were talking back to them. Piaget's pre-operational period, ages 2 to 7, highlights the stage pretty well. What is a worldview? A worldview is an integral concept in the assessment period of the client's experience. It could be defined as a way that individuals perceive their relationships to institutions, people, objects, and even nature. This often compromises the psychological orientation to life and how individuals think, behave, understand phenomenon, and even make decisions, and it provides crucial information in the assessment phase of mental health status, using assessment and diagnoses, and designing treatment programs. Each client's experience is different, and we can learn a lot about their worldview. My worldview is different from your worldview, and sometimes we both need help in different ways. For example, my treatment plan could incorporate EMDR and art therapy, whereas your treatment plan could include cognitive behavioral therapy and equestrian therapy. These are just examples of treatment plans. When considering factors that could contribute to a negative therapeutic outcome, which of the following is most likely a contributing factor? A. Regular collaboration and goal setting with the client. B. The consistent application of evidence-based practices. C. A lack of rapport and trust between the counselor and the client. D. A focus on the client's strengths. The answer is C, a lack of rapport and trust between the counselor and the client. In my internship, the first client I had, I was not sure how to build rapport and trust between the client and I because of the lack of resources I had. But the next couple clients I had, I was able to start to build that rapport and trust between the client and myself. It does take time and effort to build trust and rapport so that the therapeutic process can continue. But the lack of rapport and trust between the counselor and the client could contribute to a negative therapeutic outcome. A counselor is starting an eating disorder group. Ethically, she should blank all possible candidates to make sure they are suitable for the group. A. Screen. B. Diagnose. C. Allow a sample session. D. Interview. The answer is A. Ethically, she should screen all possible candidates to make sure they are suitable for the group. In many private practice groups, you should screen the clients to make sure that they are suitable for the group you are running. This can also be applied for residential care, but not always. That is all 5 questions. Thank you for listening. Keep calm and study on.